evening. I'm Alisa Batulan from BSN 2B13, and today we're going to perform the nasogastric tube intubation. So first thing we need to do is to verify the patient need for enteral tube feedings, assesses for presence of skin breakdown and patency of nostrils. Ask the patient to breathe and occlude one nostril at a time. So sir, can you breathe and occlude your one nostril at a time?
As the urine drains, so advance the catheter further.
And then the next is to
Um,
review the patient's medical history. And then the next is we need to explain the procedure to the patient. So sir, we're going to perform the nasogastric tube intubation for you to be to for you to be fed through a tube. And then and after that sir, if you feel any discomfort, you may use your hand signals or raise your index finger for any discomfort that you may feel once you are inserted with the tube. And then the next is
gently tap the catheter until a resistance is felt.
prepare all equipments.
And then after
And then we are going to position the patient in a sitting or high forward position. So if our patient is comatose, we need to position the patient in semi-forward position and with head prop forward using a pillow. So as is nga naka-semi-fowler na niya po patient. So the next is we need to cover the patient's chest with a towel.
and then after
And then wash hands and wear clean gloves.
do the aftercare. So remove the used material and wash your hands. And document
And then we're going to determine the length of the tube to be inserted and mark with a tape. So we need to put from the tip of the nose to the earlobe down to the xiphoid process, and then add 6 inches. Then mark with a tape. And then lubricates the first 4 inches of the tube with a water-soluble lubricant. And then ask the patient to slightly flex the neck backward. Then gently insert the tube into the nares. And then after that, we're going to ask the patient to flex the head forward once the tube reaches the nasopharynx. And then advances the tube several inches at a time as the patient swallows. Then and advance even further until tape mark is reached. And then secure the tube to the nose with a tape.
Facebook.
tape sunset cheeks. And then next is we're going to check the tube placement. So first is inject 10 cc of air and auscultate.
So now I'm going to remove the catheter from the patient. So first, ask, explain the patient that you're gonna
And
remove
then the next thing
his
is
or her
we need to
catheter.
aspirate for gastric content, and then
Um, so, inflate the balloon from the catheter.
measures measure the content.
So after deflating the balloon, so gently pull the catheter.
Then prepares the patient to for x-ray or check-up if prescribed. Next is we're going to clamp the end of the tube, the distal end of the tube, and then fastens the tube to the patient's gown with a tape. Removes gloves, dispose of used materials appropriately, and wash hands. And assist the patient for a comfortable position. Sir, are you comfortable with that position? And then document the procedure. So the next thing that we will perform is the administering enteral nutrition via nasogastric tube. So we need to assess the patient assess patient's need for enteral tube feedings or food allergies. And then the next is we're going to auscultate the bowel sounds. The next is we're going to obtain obtain baseline weight and reviews laboratory values, assess for patients' fluid volume excess or deficient, electrolyte abnormalities, metabolic abnormalities such as hyperglycemia. And then the next is it verifies the healthcare provider's order, and then to explain the procedure. So, sir, we're going to insert administering nutrition via your nasogastric tube. And then the next is you need to positions the patient position patient in high Fowler's position. So, as is na high Fowler position na. And next is we're going to wash hands and apply clean gloves. check the tube placement. So in doing that, we're going to insert 10 cc of air and auscultate. And then next is we're going to check the gastric residual volume, measure the residual volume if present. So next is we're going to irrigate the tube. And then start tube feeding. And then when feeding is done, irrigates the tube. And then cups or clumps the distal end of the tube. Maintain the patient in high Fowler's position for 30 minutes to 1 hour after feeding. So, and then the next is we're going to document the procedure.